Talk about developmental language disorders, developmental language delays. And I'm so excited to have you here because I'm going to share with you something that you're really going to want to pay attention to if you want to make gains with children who have developmental language disorders. I am going to encourage you to take all of your eggs and put it in this basket. So if you see me on YouTube, I have my Aldi free range eggs because I can't afford free range eggs anywhere else. And I also have my basket, which is from University of Florida, Gainesville. So I was there 2 weeks ago to receive a scholarship. I'm very proud of that. I celebrate that with you. Thank you for being at my side through my journey in getting my doctorate here. We have the eggs in the basket, and that's what I'm going to encourage you to do today is I'm going to say, hey, take all of your eggs if you're working with children with developmental language delays or developmental language disorder, and I want you to go ahead and put it in this basket because time is your most valuable asset, and it's the most valuable asset of the children you're working with. Exponentially more so the children you're working with because neuroplasticity is at the greatest level when children are younger. And you can make huge changes in the brain by doing what I'm going to share with you today. I'm excited to dive into this topic. Before I do, though, I am going to need to give into a little history about us treating developmental language disorder and basically how ineffective we have been at it. I'm going to go back 20 years to start. In 2004, a language professor, James Law from Newcastle University, did a meta-analysis, systematic review of our field and said, okay, what are speech language pathologists effective at? Where are we making the gains and where are we not making the gains? This was a really big study and it was really eye-opening because he looked at our research and basically he said, well, there's not much research to look at. There isn't many random controlled trials in our field. There's a lot of single case design studies. He kind of brought that to light, but more importantly, he said, we're good at some things and we're not good at other things. We're not effective. He said, we're good at improving speech sound disorders and treating speech sound disorders. We're getting gains in this area. He said, we're good at expressive vocabulary. We're getting gains in this area. We're good at improving grammar and improving syntax, which is really important. Syntax is super important. That's good to hear. We're good at that as well. But he said, but you know what? We're not making gains in language comprehension. That's something that we're not effective at. So that was back in 2004. And then we fast forward today, 20 years later, and there was a recent meta-analysis, and I'm going to put that in the show notes if you want to see it for yourself. And it was basically an exact replica of what James Law had found in 2004. In 2021, there was a meta-analysis that looked at 26 random controlled trial studies of speech language therapy. And what they found is what James Law found 20 years ago. They're good at treating speech sound disorders. They make gains in that area. They're good at expressive grammar and expressive morphology, and they're good at expressive vocabulary. We're seeing gains in that area. But they said, but you know what they're not good at? They said they're not good at language comprehension. These speech pathologists are not doing it when it comes to language comprehension. So basically, it sounded as if we weren't doing anything different for the last 20 years. We had our wake-up call in 2004, and it said, you guys aren't improving language comprehension. And then in 2021, we have another big meta-analytic study, which I'm also going to include in the show notes for you. And it says, you guys still are not improving language comprehension. When we look at this, we need to DSD and do something different. So I have read a lot of research from Trina Spencer and Douglas Peterson on their narrative interventions. And their narrative intervention, known as Story Champ, is an explicit type of narrative intervention in which the children retell the story, but they're provided a maximum level of cueing at an 80% accuracy rate. So if you know about dynamic tactile temporal cueing, which you use in speech sound disorder therapy, in which you give the child every cue in your toolbox, and then you remove the cues one by one, always maintaining an 80% challenge point. That's what you have when you look at the Story Champs intervention. You do multimodal cueing in which you're using body movements, in which you're using visuals, in which you're using icons. So it's very multimodal at an 80% accuracy rate. And then you remove the cues as the child becomes more and more independent. So it uses that type of most to least prompting hierarchy, which is very well researched. That's one thing they do. They also have the child actively involved and that the child is producing the story. This is very important. We're going to jump into the current research on narrative interventions because this is what I'm going to encourage you to do. When I say I want you to do something different, because I don't want to be here 20 years from now talking about the next meta analysis that still finds that we're not improving language comprehension. That's why I'm sharing this with you today. Trina Spencer and Douglas Peterson have numerous studies out with a variety of populations. So they've done this with children with autism. They've done this with children who are English language learners and using only English as their intervention. They've done this with children who are neurotypical as a tier one intervention in which you push into an entire class. They've done this with children who are at risk, who are in Head Start and have low language scores to prevent that referral from even happening. So they've done this with a diverse population, and it's been effective across diverse populations. Now, this is very similar to what I found in using the complexity approach when it comes to speech sound disorders. I too use a most to least prompting hierarchy, always maintaining an 80% challenge point dynamically. And in addition to that, it's complexity. This too is based off of the complexity approach, in which you're working with preschoolers that are 3 to 5 years of age, and you're teaching them the story grammar. Now, they refer to this in the research as the macro structure. You're teaching them that this is the character, this is the setting, this is the problem, this is the emotion, this is the action, this is the consequence. These are the elements of the story. Now, this used to be reserved for fourth graders. But what Trina Spencer and Douglas Peterson said is that we can take these concepts and teach them at an earlier age if we do it in a multimodal, maximum cueing manner, and then pull away the cues while maintaining an 80% accuracy rate. This is just good practice across fields, this most to least prompting hierarchy, this multimodal learning technique. And it's also the universal design for learning. So it's something that someone who's an English language learner is going to benefit from. It's someone that a child with autism would benefit from. It's something that a child with developmental language disorder would benefit from. And it's something that a child who's neurotypical would benefit from. We've got to think about asking not if the child can learn, but how can the child learn? That's what speech pathologists do. We're not here to test the child. We're here to teach the child. So always think about, I'm going to give you every single cue I have, and I'm going to see how high we can go. And when we go really, really high, then I'm going to pull away from the scaffolds. I call it the Eiffel Tower approach. Go as high as you can go, and then slowly pull away the scaffolds and don't let the tower fall. We're going to do that by staying at 80%. So I emailed Trina Spencer. I said, okay, Trina Spencer, here we are 20 years later from the 2004 study that says you guys are not improving language comprehension, James Law said. And by the way, he passed in 2021. He was a highly influential child language development researcher. So he's not here today to redo the study. However, here we have, as you'll see in the end notes, another group did. And they found exactly what he found 20 years ago. These speech pathologists and their speech therapy, they're not improving language comprehension. So I emailed Trina Spencer and I said, Trina, I see your research and I'm seeing that there's improvements in language comprehension. Could you share with me your findings? And then, of course, she emails me back. She emails me back like 15 studies that show that improved language comprehension. And here's 15 studies, and it's diverse groups of children. And I'm a little bit like, hey, I'm busy. So I'm like, Dr. Spencer, I'm busy here. Can you tell me what study, random control, really showed language comprehension gains, and not just on the narrative abilities, because that could just be practice effects. You know, we've been practicing telling narratives. Of course, the children are better at it. We don't really know if their language comprehension improved. Do we have distal measures? Do we have something that, hey, we worked on story retelling, and as a result, I see here that they're getting a better score on the self. They're getting a better score on the PLS. They're getting a better score on the standardized test of language comprehension, vocabulary comprehension. And she delivered. She gave me a random control trial test of preschoolers that found that, yes, from this narrative intervention, these children had improvement and comprehension of complex syntax. If you look at the self preschool, they embed these clauses and you pick the picture that it works with. They also had improvement in the total number of different words that they said when they told a story, a total number of words that they used, and they had an improvement, which I think is most important, in complex sentence production, sentences that contained what's known as T units or embedded clauses. Now, this is really important. Not all goals I consider to be created equally. When you get into complex sentences, you get into complex thinking. This is where you're going to start improving executive function. This is where you're going to start improving cognition, in which children are thinking if then. It's kind of this scientific, logical reasoning. This is good stuff. This is where you're going to improve, frankly, attention when children are thinking of two disparate concepts and combining them and expressing them. This is where you're going to improve the verbal working memory. Now, verbal working memory, I'm sure many of you know what that is, but this ability to process information, then you're going to take it and sequence it, and then you're going to express it. That's what you're doing when you're producing a complex sentence. That's what you're doing when you're hearing a story. You got to understand it to be able to retell it. So the comprehension improved of listening to stories, the expression and the story retell improved, but we also had those distal measurements, which showed improvement in mean length of utterance, showed improvement in T units, the amount of clauses used, showed improvement in vocabulary diversity. So this is what tells us that these children really made improvements in their language comprehension. And that's because they had to hear a story. They had to be able to understand the story. They had to be able to use verbal working memory to process that story and then reproduce it. Now, why do I say this is definitely a complexity approach? And that's because what you're doing is you're doing the hard things first. And what I mean by that is you're lifting that 100-pound dumbbell in therapy. And by lifting that 100-pound dumbbell, you're not saying a sentence that contains a morpheme. He is running. He is digging. He is, no, 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 no. We're doing tell a story. So you're having the child tell a story. You're doing not the 5-pound dumbbell, you're doing the 100-pound dumbbell. By telling a story, the 100-pound dumbbell, the child can spontaneously use the correct grammar. And that research is panning out. That was done by Amanda Van Horn and Mark Fay. And they said they had an article called Do the Hard Things First, in which they worked on complex sentences with embedded clauses and got greater gains on the small stuff, which is the grammatical morphemes, than they did had they worked on the grammatical morphemes. And that was a random controlled trial of alternative treatment groups. When we're looking at this, we're saying, do the hard things first. So in our speech therapy time, when I have my eggs, my Aldi eggs, free range under $4, I'm buying it. So these Aldi eggs that we're talking about, this is the hard stuff. This is telling the story. So in my speech therapy time, I'm going to put all my eggs in this basket, because when I put all my eggs in this basket, I get gains in pragmatics. I get gains in speech sound disorders because I'm improving the verbal working memory. I get gains in grammar. I get gains in syntax. And I get gains in vocabulary too. So, what am I going to do? Put all my eggs in this University of Florida Go Gators basket. So, that's what I'm going to do. So, what I'm talking about here is narrative intervention. And if you work with children with developmental language disorder, developmental language delays, if you work with children who are English language learners, where there's a delay in the English language development, if you're working with children with autism who have language delays, if you're working with children with cognitive impairments, because there was research done as well in children with cognitive impairments who have associated language delays. Get out the 100-pound dumbbell. You're going to get out that 100-pound dumbbell, and you're going to do it because you're going to ask, how are we going to lift this? And you're going to help that child lift that 100-pound dumbbell because you're going to use every tool in your toolbox. You're going to use movement. You're going to use pictures. You're going to use objects. You're going to use gestures. You're going to use verbal cues, visual cues. You're going to make it so explicit. And that child is going to be actively involved in the intervention. They're not just going to be looking at you do your puppet show. They're going to be doing it with you. That is how you're going to get gains. So I thank Trina Spencer for sharing those 15 articles with me. I combed through them and for pointing out this is the random control trial that we did where we showed moderate gains in language comprehension, where we also showed, hey, not only did we get a language comprehension when it comes to syntax, we also improved their MLU. We also improved their T units. We also improved their vocabulary. So we improved everything by putting all of our eggs in the narrative retell basket. Now, part of that is also story grammar. So they taught the story grammar that I went over with earlier in the gestures, and that matters from a cognitive approach because it helps the child understand the story because they know this is the rules of the game. The rules of the game is that there's going to be a character, there's going to be a setting, there's going to be a problem or an initiating event, there's going to be an emotion in response to that, there's going to be action they take, and there's going to be a consequence, and there's going to be a feeling they have as a result of that consequence. Now, whenever I attack a story, I don't come to it as a blank slate. I come to it as an active learner that understands the schemata or the scheme and how things are going to roll. And when I understand how things are going to roll, then it frees me up to comprehend when I'm reading. I understand the rules of the game. So these are highly effective approaches. And I want to encourage you, if you are working on language delays, don't pull out the deck of grammatical morphemes. Don't go to teacher pay teacher and work on the prepositions. Stop that. Don't go to teacher pay teacher, work on the adjectives. Stop that. Stop working on those 1-pound dumbbells because you don't have time to do 1,000 reps. And by working on the 1-pound dumbbells, you're not going to be able to do the 5. You're not going to be able to do the 10, the 15, the 25, the 100. Go for the 100. And stop asking if these children can do it and start focusing on how. So thank you so much for joining me this week. Before I tell you to pull up your sleeves and make the world a better place, I want to tell you about 2 different opportunities you can connect with me virtually. I'm excited. I had 2 great invitations to bring literacy to life. You better believe we are going to talk about narratives and how to bring narratives to life in the context of task-oriented movement activities. I'm so excited for this topic. So I've been invited by Division 1 of ASHA, which is my favorite one, the Language Learning Division. And that is going to be on Tuesday, November 19th live. So if you're an affiliate member of Division 1, make sure to be there. I'm going to be there Tuesday, I think it's like at 8 to 9 or 7:30 to 9. It's in the evening Eastern time. I'll be there. So be at my side. I'm going to make it worth your while. And I'm going to show you how to do this in therapy and how to bring literacy to life and how to make it so fun and so effective and so easy for you. I've been invited to do a 2-course series in January by my favorite continuing ed people, speechpathology.com. I think they're the best. You can count on them to give you good CEUs. They're the best. I'm proud to present for them. That's going to be on January 7th and January 9th live and of 2025. So that's going to be just in a little bit over a month. I hope to see you there. I'm going to do a 2-course series for them. I'm bringing literacy to life and therapy to improve outcomes. Make sure to join me for one of those virtual presentations. And of course, if you're like me and you learn by doing, then go ahead and join my SIS membership. This is what we do in the SIS membership. We do narratives. We are acting out narratives. It's narratives in the Google Slides decks every week. It's narratives in the movement activities every week. Make sure to not miss out on that. Don't delay in joining the SIS membership today. It will be a total game changer for you and for your students. So roll up your sleeves, make the world a better place, one child at a time. You are always going to be first.